Hello everyone. Today I am going to present a clinical case of paraphylaxis. It is also known as summer bleeding disease. It is a parasitic disease that we are going to discuss. So let's start. We will start with a small video. Here in this video you can see a number of blood spots on the skin of this goat. Here you can see the blood spot, and there is another. So this parasite causes bleeding spot at various points of the body. Here you can see there are a number of blood spots. In this picture you can see clear there are the blood spots. These are due to the parafilariasis, which is a parasitic. So we take into account the history and detail. In our clinic, a goat was presented at the medicine clinic with a history of lesions on the skin, and blood was coming out of these lesions, as you have seen in the previous picture. These are the lesion spots, and blood was oozing out from these lesions. Farmer told that he bought the goat 10 days ago and lesions were present at that time. The goat parturited 8 days ago and kids are however normal. Upon clinical examinations, we found that the temperature was 1, which is slightly, you can say, it is in normal range. The pulse was 72 and the respiration rate was 26. And apart from this, there were lesions on the skin and blood was coming from them. That was the major clinical signs that was relating to the disease parapilariasis. So on the base of these lesions and the lesion skin and the blood that was coming from them, we diagnosed it is a case of summer bleeding, which is also known as paraphylaxis and is caused by bovicola. The Parafilaria bovicola is the parasite that causes this paraphylaxis disease. So if we discuss about the pathogenesis, Parafilaria bovicola is transmitted by flies in genus Musca. Fly containing Parafilaria bovicola larvae feed on the wound and ocular secretion of the animal. Larvae migrate on skin, develop into adult in 5 to 7 months. 2 months later, gravid female worm break the skin to deposit their eggs, and the free larvae are shed into the discharge of bleeding or serohemorrhagic fluid. The treatment is injection Zoramet 1 ml subcut and repeat the dose after 7 days. We talk about the follow-up for this case. On the 8th day, owner repeated the dose of the Zoramet after 15 days, i.e. after 2 weeks. The owner told that the goat is slightly better than before. Here are the pictures of the follow-up. Here you can see the pictures that are before the follow-up and before the treatment. Here you can clearly see the hemorrhages, but these are the pictures of after follow-up. Here you can see there is a great change and there is a slight recovery than before the animal was being treated. Here you can see the hemorrhages are clear, the blood is still coming out, but here in case of after treatment the blood has been stopped. So this was the case of parafilariasis. Hope that you will have learned new things from this case. So please subscribe to our veterinary channel. Thanks.